Okay, guys, so we're going to pick up here with the antimicrobial proteins. All right, so this is underneath the innate immune response. So this is the type of immunity that we're talking about. So we're going to respond to these pathogens all the same way. So we've got a lot of different types of antimicrobial proteins. The first group we're going to look at is called the complement proteins. Now, by complement, basically it's a group of molecules that we look at as one system called the complement system. There's like 20 or more different plasma proteins, and all of them are going to be made by the liver. So we name them. They have C and then a number. And a lot of these proteins actually work in both innate and adaptive immunity. So you're going to see some overlap whenever we get to adaptive immunity. Now, they're circulating in the bloodstream basically in an inactive form, and they have to be activated just like many other enzymes and proteins in the body. And that activation involves a really complex cascade of events that starts when you have some type of injury or some type of damage to the tissue. Now, we're going to kind of look at what they do. Once these complement proteins get activated, they have 5 main effects as to how they deal with pathogens. The first thing they do is cell lysis, which basically means they pop the cell. Some of these complement proteins are able to lyse or pop the plasma membrane of the pathogen, and that of course leads to their destruction. C5 is one of the main complement proteins that initiates this process, and it basically binds to the surface of the pathogen. It makes like a docking site for other complement proteins to join in. Together they form a MAC, which is a membrane attack complex. Guys, the MAC is this right here. Do you see these blue bubbles that form this hole on the membrane? That's the MAC. Now, C5 is the first one that comes to this surface, and then all these other complement proteins are going to come in and help C5 form this MAC. Now, the MAC inserts itself into the plasma membrane of whatever target cell, and it creates a pore. So it basically is drilling a pore to get into the inside of this cell. And then these complement proteins are going to blast the inside of this cell with all kind of chemicals, and that causes it to lyse or to pop. And you can see right here it's popping. So sort of like basically it blows the cell up pretty much. But you need to make sure you understand what that MAC is. That's that membrane attack complex. That complex drills a hole, shoots it full of these chemicals, and it causes it to lysis or to pop. Okay. The second effect is enhanced inflammation. This is that inflammatory response. It is a non-specific response. Several of these proteins are going to enhance this by triggering basophils and the mast cells. And y'all know those are the two main cells that release chemicals that help mediate inflammation. So it's basically just going to help control and moderate that inflammation. Now, the third effect is to neutralize viruses, and this is mainly done by C3 and some other components of that MAC. Again, there's that membrane attack complex again. Basically, they bind to viruses and they neutralize them, which means they block them from infecting other host cells, because once viruses infect other host cells, then they start spreading. Remember, a virus cannot replicate, or it can't reproduce unless it's inside a cell. So we have to neutralize them, block them off, and prevent those viruses from further invading other cells. And I love the images in your textbook. Y'all know how much I love this book. But these are really great. This is showing that enhanced inflammation. These are the basophils. These green and blue dots here, those are the complement proteins, and they're mediating. They're releasing those chemicals. They're going to help mediate that inflammation. And then this one is neutralizing the viruses. You see the C3 complement protein, and again, here's the virus, and we are forming that MAC. Except this MAC looks a little bit different. Instead of a tiny hole in the pore like the previous one, we've actually going to surround the whole virus, and then that's going to neutralize it, and eventually the virus will die. Okay? All right. The fourth main effect is enhancing phagocytosis. So again, C3 is going to do this. It acts as an opsonin, which means it binds to the pathogen and it does opsonization. Now, opsonization basically is making the pathogen more appetizing for the phagocytes. So it makes the phagocytes bind more strongly to the pathogen, and it really makes phagocytosis better, faster, more effective. All right, so opsonization, make sure you know that term. And here's a picture right here. It says we've enhanced phagocytosis because we've done opsonization. C3 coats this bacteria, and this makes it really yummy for this macrophage to engulf and phagocytize. Okay, and then the last one is to clear immune complexes. C3 binds to immune complexes. These are basically clusters of antigens and antibodies. You know, they make those clump, and it triggers phagocytosis. We need to clear these complexes from circulation, which is critical to prevent them from getting lodged in different tissues, because that can cause a blockage and that can cause more problems. So anytime we have antigens and antibodies bonding, which is right here, this C3, there's that complement protein, it is going to initiate phagocytosis so that we can get rid of this complex, get it out of the system, so it doesn't prevent a blockage or get lodged somewhere in the body. Okay, and again, there's our trusty macrophage getting rid of it. Okay, all of that was the complement system. Now, we have the other group of proteins called cytokines, okay? And they're produced by several different immune cells. They enhance the immune response in some way. Several of them that are involved in innate immunity are these, okay? So these are going to be the main ones that we look at. All three of these are types of cytokines, and they're all going to be involved in that innate immunity, okay? So the first one is the tumor necrosis factor, or TNF. It's a cytokine that's mainly secreted by macrophages that are activated in response to bacteria. Okay, it attracts the phagocytes to the infection area, increases their activity, and it also stimulates them to release even more cytokines. All right, so that's what the TNF does. Now, this one is the one that induces flu-like symptoms. This is when you feel really, really sick. Fever, chills, aches and pains, all of those things are because of inflammation. Okay, so it doesn't feel real good, but it is a sign that your body is fighting off the infection. Okay, and that's because of that tumor necrosis factor. All right, the second is interferons. These are cytokines that are made by macrophages, dendritic, natural killer cells, as well as cells of adaptive immunity. Okay, they are produced in response to infection, like viruses or bacteria, and their primary action is to stop or inhibit viral replication inside the host cell. So they're going to prevent the virus from replicating inside the host cell, because you all know when the virus replicates inside a host cell, then it's going to spread and it's going to infect the entire organism. And so that's what interferons really try to do. And again, mainly they're responding to intracellular agents like viruses and bacteria. Remember, intracellular means things that are within the cell. All right, and then the next one is called interleukins. There are 29 different types of these, and these are mainly produced by leukocytes. They stimulate neutrophil production in the bone marrow. They stimulate natural killer cells. They trigger interferons to be made, and they activate T cells. So these are basically activators. It's kind of what I think of interleukins. They don't really do any response themselves, but they get everybody else geared up and ready to go and fight whatever has come in the body. And again, remember that a lot of these cytokines, especially TNF, are going to make you feel really, really sick in the beginning of the onset. Okay, let's look at the inflammatory response. We've mentioned that several times, so let's actually get into that. This is an innate response that happens anytime a cell's damaged. This could be viral invasion, bacterial invasion, chemicals, heat, toxins, trauma, accidents, anything that damages the cell. And there's two basic stages. Step one, the damaged cell releases inflammatory mediators, and that causes a local change in the tissue. And then the second phase is phagocytes come up and they clean up everything that's damaged. All right, so that's sort of what we're going to look at. So let's look at step one. This is part one of the inflammatory response. So first thing, of course, the damage occurs. Okay, that damage initiates the inflammatory response because the damaged cells and any mast cells that are nearby and local, they release the mediators, the inflammatory mediators. Now, those mediators can be histamine, serotonin, cytokines, bradykinin, prostaglandins, any of these chemicals. They're going to start helping kind of control this cleanup process. Now, what do all these chemicals trigger? First thing they do is vasodilation of the arteries. Now, vasodilation is increasing the diameter of the vessel, so that's going to allow blood to flow faster. It's also going to allow it to flow more freely to the injured tissue. So it's going to get the blood there faster. Now, why do we want blood there faster? Well, that's where all the good stuff is. That's where all the cells are going to help us. That's where they are, and that's how they get to that injury site. Remember, blood is our transporter, so we've got to transport all the good stuff there. Now, this creates redness and heat. Okay, so it's going to get red. It's going to also produce heat because of that increased blood flow. And again, that is part of the signs of inflammation. We have 4 cardinal signs of inflammation: redness, heat, swelling, and pain. That's what tells you, okay, we got a problem. All right, now let's get control of it. The second thing that these inflammatory mediators are going to trigger is increased capillary permeability. So remember, capillaries are typically all tight junctions, so they're not very permeable because we want the stuff staying inside the capillary. Well, there are some proteins like clotting proteins, fibrinogen, complement proteins, all these proteins that we need to repair the tissue. They've got to get out of the bloodstream and into the tissue. And the only way to do that is to get through the capillary wall. So we're going to increase the permeability, which means we're going to allow more things to come out, especially these larger proteins. They've got to get out of the blood. Does them no good if we rush them to the site and they can't get out of the capillary. So that these inflammatory mediators are going to help increase that permeability so all the proteins can actually get out into the tissue. Now, this causes swelling, which is another word for edema. Okay, so swelling is one of the cardinal signs of inflammation. All right, and then pain. All right, and that's the next sign of inflammation. Pain is not fun, but it is a protective function. Lets us know, okay, there's a problem. We need to avoid any further damage. It also causes a temporary loss of function, which means that your body needs to rest that body part so that the damage can start. All right, so that's basically what pain is for, so that we don't use that so that the body can take care of it. And then lastly, we're going to recruit other cells via chemotaxis, and this is what leads to the next part of the inflammatory response, part 2. But now let me talk about chemotaxis for just a second. Chemotaxis is like a breadcrumb trail, except it's using chemicals. But it's like a pathway. It's how all these cells and all these proteins and all this phagocytes and all this stuff that we need to come and help us take care of the damage, it's how we get them there. All right, that chemotaxis is like a little chemical breadcrumb trail. That's how we have to recruit other cells. All right, and that's basically kind of like attracting them to the site so that we can get this job done. And then make sure you know the 4 cardinal signs of inflammation: redness, heat, swelling, and pain. All right, so here's what I really like. This is the picture. Okay, so step 1, we have something that has caused damage. This piece of wood has broken the skin and is now into our tissue. So there's our damaged. Well, the damaged cell here and the mast cells, these are mast cells, they're local, chilling out in this tissue area, are going to release all these inflammatory mediators. Look at all the purple dots. Those are the chemicals. Those are the inflammatory mediators. Look at where they're acting on. They're going straight to that capillary, which is going to cause vasodilation of the artery, so the artery is going to get larger, allow blood to flow faster, increase capillary permeability. All these proteins are going to be able to come out of the cell. All right, so again, redness and heat is caused by vasodilation. Swelling is caused by that increased capillary permeability. You still have your mast cell here releasing all these little purple chemicals. Okay, then pain. All right. Possible loss of function, which is good. The nerve endings in this area are sensitizing that something's happening. Okay, so that's where you have your pain. And then we're going to recruit other cells using chemotaxis. And this gets us to part 2. But because we've increased the diameter, we've increased the permeability, all these good monocytes and neutrophils can get to the area site and then they can get out. All right, and they can start cleaning up the damage and start the repair process. All right, so now let's look at part 2 of the inflammatory response. This is when the phagocytes get involved. And basically it's divided into stages based on which phagocytes enter and what processes happen there. So your first responders are your local macrophages. Obviously, they're activated within minutes of the injury. They're already there. They enlarge and they begin to phagocytize the pathogen and any damaged cells. Only the phagocytes that are there within the first hour of the inflammatory response they can perform really critical functions of containing the invaded pathogen. So once these local macrophages are activated, they're really going to focus on containing the pathogen, preventing the pathogen from invading any more cells and causing more damage. So that's what local macrophages are really taxed with. That's their job. Now, neutrophils migrate by chemotaxis to the damaged tissue. They're going to phagocytize bacteria and cell debris. Those inflammatory mediators and any of the complement proteins that are activated attract neutrophils. That allows them to leave the blood and get into the tissue. Now, these inflammatory mediators are going to make the capillary endothelium sticky. Okay, just in the damaged area. Remember, the endothelium of the capillary is the inner lining. It's the inner tissue lining. Now, because they're going to become sticky, the neutrophils are going to adhere or stick to the capillary wall. This process is called margination. All right, so they're going to adhere to that capillary wall, margination. Now, because the inflammatory mediators increase capillary permeability, that provides spaces between those endothelial cells so that the neutrophils can squeeze through and get out of the capillary and get into the damaged tissue. Now, this is called diapedesis. They destroy the bacteria and the other cell debris. Okay, so two big terms there, margination and diapedesis. Margination is the neutrophils sticking to the capillary wall because the inflammatory mediators made the wall sticky, so they're going to stick there. And then diapedesis is when the neutrophils are going to squeeze through that tissue and get out into, or squeeze through the cells to get out into the damaged tissue and start destroying bacteria. Okay. Now, the bone marrow releases more neutrophils into the blood, and this, of course, is going to lead to a really fast rise in the circulating neutrophils that are actually in the blood. Okay. All right. Monocytes also migrate to the tissue via chemotaxis, and they become macrophages, so they get rid of pathogens and debris. The bone marrow is going to increase production of the leukocytes. The cytokines that are produced by those phagocytes are going to act on the bone cells in the bone marrow, and they're going to tell them to increase that production of neutrophils and monocytes. So for the next 3 or 4 days, the bone marrow is going to release a lot of leukocytes. That leads to an elevated number of leukocytes in the bloodstream, which is called leukocytosis. We've probably heard this as a high white cell count. That just means that elevated number is getting that damaged area cleaned up and cleared of any pathogens so that we can start healing. Okay. Now, sometimes pus forms, which is just a mixture of dead leukocytes, dead tissue, fluid, kind of leads to a gross white mixture that we call pus. Okay. All right, and here, of course, is the picture form. So right here in part 2, the local macrophages are activated, so they're going to immediately start doing phagocytosis. The pathogen, the damaged cells, are going to start eating those. Neutrophils migrate by chemotaxis to the damaged area. This, y'all, is a picture of margination. See how they're sticking to the wall? All right, and then monocytes, right here you can see diapedesis. Right, this is that neutrophil squeezing through. All right, we're squeezing through to get out into the tissue. Monocytes migrate again by chemotaxis. They become the macrophages, and then they're, of course, going to start eating cell debris as well as pathogens. And you can see the neutrophils and these monocytes are going to continue to do that. All right, so here's that diapedesis in this picture. Okay, so diapedesis, margination. Margination is the neutrophil sticking. Diapedesis is the neutrophil squeezing through the endothelial cells to get out into the tissue. And then over here you've got the bone marrow. Increases the production of leukocytes, which leads to leukocytosis, which is that high elevated white cell count. Okay, all right, we're going to stop there and we'll finish up with fever in the next video.